Welcome to this episode of Youth Diary. Today we have with us Dr. Urmila, who is a leading gynecologist and a laparoscopic surgeon with PVS Memorial Hospital, Kallur. So doctor, welcome to the show.
Thank you.
So well doctor, if you could just explain to the audience as to which part of gynecology you are specializing on, it will be easy for us.
Actually, I'm specialized in laparoscopic surgery, more in the field of pelvic reconstructive surgeries. So that's an area where people overlook and they don't get proper treatment for such relaxation of pelvic organs, and definitely they land up with decreased quality of life and decreased self-confidence.
Okay. So then we have a few questions through mails also with us, So one of the mails actually says is, my sister is pregnant, and when she consulted doctor, the doctor said that she has pelvic organ prolapse. Now, what are the causes of this particular problem?
Actually, in this question, the age of your sister has not been mentioned. Thing is that in younger age group, particularly in this sort of patients, when they get this pelvic organ prolapse, there must be an inherent defect in their pelvic musculature or fascia, which is there when they were born itself. So whenever there is a stress condition like this, as in the case of pregnancy, there is a tendency of these pelvic organs to prolapse. So next question is what she can have now. Definitely she has to continue her pregnancy, get the baby delivered, and after that she can go in for a reconstructive surgery. Otherwise, this prolapsed pelvic organs will not go back to their proper position as they were before in the body. And this can be done either with her own ligaments of fascia, or you can use other materials like orthologous materials like mesh, tapes, etc. And that depends upon how much strength her inherent ligaments and fascia can provide for her later support.
So doctor, we were talking about this prolapse. Now, what are the corrections that can be done, and can a person be pregnant after these corrections are done?
Yes, surely, as I have already talked to you earlier, these pelvic organ prolapses, they can present at the earlier stages of life. When that happens, definitely before surgery, if you get this corrected, you can have pregnancy after correction also. So in such cases, definitely orthologous material like meshes or tapes has to be put in to take care of the problem.
So we spoke about correction and all, but exactly what are the causes of this particular problem, ma'am?
When this pelvic organ prolapse, when it occurs in younger age group, this is mainly because of the inherent defect in their fascia and musculature, where there doesn't have enough support for the whole system. But when it start developing by after 35 years, actually the problems are due to birth trauma, like prolonged second stage of labor, instrumental deliveries, and large birth weight of the babies. All these things can definitely injure these pelvic musculature as well as the supporting system. So in later life, when the hormones in their body gets lesser and lesser, they'll have a tendency for this pelvic organ prolapse. That's one of the reasons. The next thing is that morbid obesity, that's a major cause. Whichever conditions which increases the intra-abdominal pressure, this can definitely lead in for pelvic organ prolapse, as in cases of chronic asthma, chronic cough. So all these things, when it happens in your life, get it corrected at the proper time. Otherwise, you will have to lead with other chronic diseases like pelvic organ prolapse. The problem is that in pelvic organ prolapse, it's not only the uterus which is coming out. There are associated structures in front and back of the uterus. Actually, anteriorly, you get the bladder. So when this supporting system anterior to the uterus gets weakened, as in the cases of birth trauma, what happens is that part of the bladder also comes out along with the uterus. So this is a condition called as cystosy. The symptoms which patient get at that time is that she'll start experiencing increased frequency of micturition. That's quite often she'll have the urge to pass urine, and even if she passes urine, she'll have a feeling that bladder is not emptied properly, and again After a long time, what she develops is that she'll start getting urinary tract infections repeatedly. That is because of the incomplete emptying of the bladder. Even if she empties the bladder, there will be a little bit of urine which will be held back in the bladder, and this will act as a culture medium. So again, when she is not bothering about this and she starts getting this repeated urinary tract infections, what happens is that there will be a retrograde infection to the kidneys, and then the whole picture just turns. So whenever you feel some weakness in that area, just go to the doctor, check, and find out what you can have a solution for that problem. Now, in the same way, posterior to the uterus, the back of the uterus, you get your bowel. So all these structures are very closely associated in such a way that when the structures posterior to the uterus, the holding structure, supporting mechanism posterior to the uterus, when they get weak, as definitely in the case of this birth traumas, chronic cough, whenever you get the intra-abdominal pressure raised. So in such cases, what happens is that bowel also start prolapsing out through the vagina. So such patients will start experiencing back pain, incomplete evacuation of the bowel, constipation, and whatnot. So definitely, they, along with the feel of low self-esteem, they'll be really trouble with all these problems. This goes on with their daily routine activities, and finally the whole performance just gets lowered.
So how do you basically treat this? I mean, how many days correction is this? Like how many hours or days will it take for this particular procedure?
See, in laparoscopy, how we treat these patients is like it's a site-specific repair. It's not like you get a fibroid or a cyst in the uterus or ovary and remove the cyst and finally the problem is tackled. It's not like that. It's like it's a site-specific repair. That means not every patient should have cystocele, rectocele or prolapse uterus. Certain patients, they have only an anterior compartmental defect where the bladder comes out, or she gets that problem with the urethra, supporting system for the urethra. So what she gets is a stress urinary incontinence. That means when she coughs or sneezes, just urine leaks out. So that is being tackled in a separate way. So each compartment is taken differently, and appropriate treatment is given to that area which is weakened. So this can be, again, as I said, this can be with her own tissues or with autologous material like meshes and tapes. So actually, when you deal it laparoscopically, you need to stay in the hospital only for 3 days. And the most advantage of having this laparoscopic surgery is that early return to your activities. You have to be, you can go back to your routine activities within 10 days. It's not necessary that you have to remove your uterus to correct your pelvic organ prolapse. So before repositioning the uterus, what we do is that preoperative preparation, we'll confirm that the uterus which you are going to keep it back is completely healthy. For that, we'll have a complete ultrasound examination of the uterus. We'll have a pap smear, and if she is having some menstrual irregularities, that part will be corrected first, and then we'll be thinking about the repair. So as I already told, it's a sort of site-specific repair. In the postoperative period, actually, when we are correcting this by laparoscopic method, only 10 days of rest is being advised to the patient. After 10 days, she will have to come back and visit the doctor. Then for next 6 weeks, the only precautions she has to take is that she is not allowed to lift heavy weights, or and also she is not allowed to have sexual contact. This is the only restriction which we give the patients. So they can go back to their routine regular activities after 10 days.
So doctor, this is over to the audience side. They have few questions for us. This is the first question.
I am Rini from KME Engineering College. I have a doubt what it means that we have irregular periods.
The normal menstrual cycle is a 28-day cycle. Actually, first 14 days you have the proliferative phase, and the second 14 days you have the secretory phase. This is the normal pattern, 28-day cycle. So irregular cycles means if you are going to get your periods once in less than 3 to 2 weeks, or if you are getting it more than 45 days duration, you are supposed to have irregular periods. So in both the both the cases you will have to take treatment, because if you are going to bleed every 2 to 3 weeks, then what happens is that you are going to become deficit in hemoglobin. That means in a normal menstrual cycle, you are supposed to lose only about 60 to 70 ml of blood. So when this happens quite frequently, then definitely the blood loss will not be enough for your body resources to compensate for that, and you will definitely land up with anemia. Now, what happens if your cycle get prolonged? So what happens is that when you are getting your cycles once in 45 to 50 days, 60 days, in such cases, if it is going to get prolonged for more than 2 months, then definitely you will have to consult the doctor and take appropriate treatment for that.
Because of this, I think there can be even weight gain.
Majority of the cases like this, when you have this prolonged cycles, this is commonly associated with a condition called polycystic ovarian disease. In such cases, what happens is that there won't be proper ovulation. So actually this is genetically determined condition where in the families they be running diabetic gene in them. So what happens is that all these hormones are interconnected. There is an axis called hypothalamo-pituitary ovarian axis, where all these hormones right from the brain is acting on your ovaries to produce estrogen and progesterone. So when you get these prolonged cycles, actually this is a result of what is happening in your body. This is an indicator. So you have to correct this. Definitely when ovulation is happening in your body, then only you'll have the hormone called progesterone in your body. The progesterone withdrawal is the one which is causing irregular cycles. So these girls tend to become more and more obese. This obesity will increase their androgenicity in the body. They'll have particularly these polycystic ovarian girls, they have PCO girls, they definitely have this acne, lot of acne, the pigmentation in and around the neck, they'll have this central obesity. So what we advise for such girls is that you have to modify your lifestyle pattern. So first and foremost, when these girls come to our OPD, we don't start them with hormones or medications. What we advise is to have a proper lifestyle modification, which includes a proper diet, proper exercises like yoga. They are asked to drink a lot of water, and also they are asked to consume a lot of vegetables, and also the pigmented fruits and vegetables, which contain a lot of antioxidants, which can definitely revert their pathologic process which is going on in their body. And once they start reducing their weight, the androgens in their body start reducing, and definitely they'll go back to their regular cycle pattern. And this correction is more easier than going in for medications. And that too, diet is a very important thing which they have to take it very seriously. Less amount of all these junk foods, go in for vegetarian, vegetables, green leafy vegetables, fruits, and they should have all variety of fruits and vegetables in their diet, and that is very important.
This is the next question.
Myself Fatma Merjibin, I am from KME Engineering College. My doubt is that what is spotting and why does it happen?
What is spotting? Intermenstrual bleeding. It's not like you'll have a proper staining of your sanitary napkins. Like it will not be, spotting means it will not be more than 2 to 3 ml of blood. So this can happen intermenstrually, particularly at the time of ovulation. That means about 12 to 13 days after your periods, you can have the spotting. And also you can have the spotting just prior to your periods. Probably about in a 20-day cycle, it can happen in around 23, 24, 25 days you can have spotting, but this is also quite normal. But when the spotting becomes bleeding, then and at times which I have mentioned, other than times which I have mentioned here, then it becomes a problem and you have to consult the doctor.
This is the next question.
I'm Sneha from KME College, and ma'am, I would like to know why I suffer from abdominal pains during my regular periods.
Normal menstruation, what happens is that there is a lining inside the uterus called endometrium, and this is being shed regularly during your periods. So what happens is that once the hormonal withdrawal occurs, then the uterus will start acting, that is, the muscles of the uterus will start contracting, just causing this blood and the endometrium to come out of your uterine cavity, and this is the cause for pain during menstruation.
We have one question, doctor. That is, which is the commonest age group for pelvic organ prolapse? And there is one more question associated with that, which is like, can you get POP even after hysterectomy?
Okay, about 60% of the patients having pelvic organ prolapse will be above 35 years of age. This is because once the lady gets into 35-40 years, the hormonal estrogen, particularly the estrogen, which is responsible for the feminine characters of the body, this estrogen start decreasing in the body, and slowly there will be weakness of these muscles and fascia, and their symptoms will start getting exacerbated day by day. So once the lady reaches menopause, definitely there won't be any estrogen in their body, and again this relaxation just goes on increasing day by day. And next question which he asked was, is there any chance for pelvic organ prolapse after hysterectomy? Very relevant, because people have a concept that once you have your hysterectomy done and if you have a pelvic organ prolapse, this cannot be repaired, but it is not so. Even if you remove the uterus, there are organs in the pelvis, like I have already said, there is a bladder, there are bowel inside the abdominal cavity, and when these tissues and musculature get weakened, there is every chance for these organs inside your pelvis to come out. Even if after removal of the uterus, when these organs start prolapsing, you have to get it corrected, and this can very well be done with laparoscopy. And in such cases, in the postmenopausal age group, when they are presenting with weak fascia and supportory system, what we can offer them is that the site-specific repair using meshes and tapes. The tapes and meshes which we use for this repair, they are definitely they are homologous materials, and they have got their own inherent problems which will not occur for every other patient. So with caution, when they are used with proper prerequisites fulfilled, then they are going to be lifelong, and they can have their pelvic organ prolapse corrected for once and all.
Thank you so much, doctor, for spending your valuable time here with us. And you all will be having a lot of questions in your mind. Today we have come to an end of this episode. So you can mail us on youthdiaryrosebowl@gmail.com, and we will come with your answers next week. Till then, bye-bye.